All right, on this woman right away, I see the first thing that jumps to me is the shoulders and the hip, the left.
Yeah. What do you see?
I see a big hip hike.
You see a big hip hike.
Yeah,
Hmm.
on the left, which the shoulder.
Nice. I
No.
would be very curious to know if this person had scoliosis. And I say that because I love what you're seeing. You're seeing the shoulders. Oh, can you see my? I say that because here's her shoulders, right? I love what you're seeing on the shoulders. I want to address this rib cage
Mm.
because all shoulders need to do is rest on their rib cage, and it's very subtle. Do you see? Oop, go back for a minute, Dr. Reese. Go back. All right. You see these teeny little tiny points right there? And then there's one right here. Yeah. You start to really look at people's clothing, guys, when you're out and about. Like her clothing is telling everything that's happening. Everything is happening. So you see right here,
Mm.
that little spot where
Yeah.
my arrow is. And this little spot where that arrow is. Those are the tips of her shoulder blades protruding through the back of her shirt. We call it winging. And it is tells us her serratus is weak.
Oh, so you're talking about this
Mm-hmm.
and this.
Mm-hmm. Those are her shoulder blade points poking out the
Right,
back of her shirt.
right.
And you see this a lot on the red carpet in Hollywood. For a little while, it was super vogue to have winging shoulder blades.
Yeah.
You know, because fashion can do terrible things to the body. But when you see winging scapula, it always means there's a weak serratus. I mean, that's just what you know. And the serratus is the muscle that helps bring the shoulder blade down and around under the armpit, and it works with the trapezius. So if you've done a push-up and you're not good at it, your trapezius and your serratus are not balanced.
Right.
So we can look at those muscles, but we can also look at this rib cage part because the shoulder blades can do nothing unless they have a palate. They need the rib cage. So what you were drawing a beautiful box. Can you highlight right below where maybe the bra line would be and to the hips? We'll make that box.
Yeah.
And we'll go a little higher because we're just going to look at the oblique windows. We've talked about those windows. And you and everyone out there, please observe the space between the left arm
Mm-hmm.
and the right.
Yeah.
Mhm.
And yeah, this is a big rotation.
It is a big rotation. And when you guys are trying to figure out how to, Dr. Reese and I talk about rotation, we're going to utilize that we are on the face of a clock. And as a person turns to their right hand side, not our, the person's right, they're going clockwise. Okay. So this individual has a rotation that's going clockwise, or you can observe her left shoulder is forward, her right shoulder is back. But her shoulders are that way because her thoracic spine is that way as well.
Mm.
And then, as you saw, the hip hike as well.
Yeah. Yeah. Yeah.
Yeah, for
And,
sure.
and I don't know if this is her stance or she just stood this way for the photos. But if this is her stance, we got some knock knees and some very weak hips, right?
We do, and yet she's very strong. Isn't that ironic? Like she's
Yeah.
a she's strong in the calves. They may be the only things that are holding her onto the planet.
Yeah.
Uh, but
And entering my field of nutrition, I see nutritional deficiency here from
the varicose veins, yes.
yeah, but that's another topic.
It's another topic, but it's a topic of elasticity and strength
Right.
and tension and varicose veins don't have that the same as arteries, right? So if they're not able to push all that blood back up, they're just doing nothing, and that's a lot. Like our body can help that. Right? That doesn't have to stay like that. Let's go look at her feet. And I'll tell you why we're going to look at her feet, and then we're going to go look at that skeleton. So the feet, this is considered we didn't tell her what to do. She took a closed stance, meaning she's real tight through there. But if you even look at the feet, the way the feet are built, she's got a longer big toe. She might have a little bunion activity on that right foot. It looks suspicious.
Oh yeah, she did. Now that I think about it, she told me she was a dancer.
Oh, okay. Ah, everything actually starts to make sense. Poor dancers. She's a dancer who no longer dances.
Correct.
Yes.
Correct.
Oh, the lights
She's
go
all
off.
messed up. And I didn't even tell you the big symptom that she's very worried about yet because we're letting it all unfold.
All right, let's unfold.
So the big symptom is her left leg. She's saying that her leg just isn't walking correctly. Like
Oh,
it's like a stiff pole.
yeah, for sure.
Yeah.
Okay, so go back up. Let's go look at the rib cage and the torso. So right there, perfect. Just leave your marker right there in the front of that left hip. I can almost guarantee that she throws her leg when she walks, which is why there's not power in it. The rotation in this woman's body is really strong. I would be curious if she has scoliosis or if that's from years of dance. Dance is really one-sided. If she was someone who did pirouettes and spins, right? It's like any sport. We always go to one side. We have a gesture leg and we have a stable leg. Traditionally, the gesture leg is very mobile and then the other one is very stable. And then eventually in a dancer's, they're like, oh, my hips. So where you're pointing right there, you can almost see the fabric in her clothing. She does a little spiral thing, I am sure, when she walks.
Mm. Yeah.
Let's look at her sides. Let's look at the sides. I'll show you the spin. So this is her left side to us.
Yeah.
And her left side looks like it was the standing side, right? It's not a bad picture at all if you draw the plumb line. Left side looks suspiciously
And
lovely.
she is straight for the most
Yeah,
part. I mean, her knees are out in front, but
but it's a pretty good plumb line, right?
yeah,
But
it
this
is.
is why I love that you're doing this for our audience as well. Let's go look at that rotation. Let's go to the other side.
Yeah.
And where you can see rotation, if the plumb line's not something that's really quick for your eyes out there, guys, observe her body is also in rotation. We can see more of her left foot. We can actually see her left breast coming around the corner a bit. We can see even on the floor, like she has a rotation. That's why when we looked at her back, her shoulders are crooked. So we could just be shoulder people and be like, oh, we're going to fix those shoulders. But until we take away that rotation, and posture therapy is always trying to do reduce rotation, neutralize the pelvis, work from the inside out.
Yeah.
Right. So reduce rotation is the first thing up for this gal because she's actually doing a really good job. She just needs her rib cage to get lifted and put back. And that would help her.
I'm just amazed at the hip height. If her shirt was tucked in, we'd see it more.
You can look at the bottom of her shorts. Go look at the bottom of her shorts.
Oh yeah. Yep. Oh, I mean, look at that. That's pretty.
But I also want people, like, if you're out there or even in your own body, if you move your rib cage to the left, your hips are going to kind of go with that. Like, if you almost imagine her whole left side is rotated and there's a hip hike and everything, it's like she's standing on that left side. So that's why I say a lot of times a dancer will post on one side. I guess I keep thinking of a pitcher. If you're not into dancing, right? The pitcher has, like, there's one side they're throwing from, and then one side that the coil, just any one-sided sport, tennis. This woman has a spiral. Like, and if you can't see it, put it in your body. Put your right arm back, put your left arm forward, and you can feel like, oh, she's about to go somewhere.
Yeah.
And then if she tries to go the other way, it does not work, which is why she doesn't feel like the left leg does not go into extension because the right leg is already there and she thinks she's standing up, right? This is cattywampus, as the architects say. This is a cattywampus structure because the feet are not going in the direction, the feet are going over here, the body's going over here, but the head is going that way. So she's got one side of her spiral, and that would probably really make for her glutes are weak. Her hamstrings, they're probably a little tight, but over lengthened. But her glutes are
And
weak.
the femur looks rotated too. I don't know if that's just the way
We can look at the femur for sure.
It looks internally rotated to me, but
It's because she's standing so
look
close.
at that.
Well, that's what the leg bone looks like. To be really honest, she's very thin, right? And now that's why I say, look at how close she chose to stand. So if we asked her to put a hip distance or a fist between her feet, she would open up a little bit.
Okay.
Does that make sense?
Yeah.
Because she's really thin. That's part of why there's an illusion. But now, like I say, look how close her legs are together. Her ankles are touching, and yet her knees are not. And that's okay, right? So this individual has some really strong legs, but they're not connected to her hips at all, which I think is why it's good when you said dancer, right? Because you could actually see if these legs were really strong, externally rotated and leaping around. But I do know a lot of dancers who don't know how to walk very well.
Yeah.
Just dancing and walking. The best thing she could start doing is walking backwards more, walking on a 1, 2, 3 waltz count. Getting her hips, we could get her to do some more contralateral indications, meaning when you walk, your left arm and your right leg have a rhythm.
Right.
Kind of goes back to us talking about crawling. So for us to be balanced in the world, why don't you pull up the skeleton for people and we'll take a look at that skeleton? Because a lot of people, so essentially this is you guys, right? And this particular woman that we're looking at, if you could imagine that rib cage has shifted and rotated.
Yeah.
And to make that happen, the hip has to follow because as you guys see, everything's connected one at a time all together. Now with your rib cage is very mobile. And you know that because the ribs move when we breathe. We've got all sorts of muscles, and then the shoulder blades, as you can see, Kevin, are back there, right? On this particular individual, her shoulder blades are so wide on her back and protruding that those scapulas are not sitting in that position the way we see in this skeleton. That is causing her rib cage to not stay where it needs to be because the muscles aren't working. Let's see, can we find, there we go, see serratus anterior. We could go look at the serratus, and that was very weak on her. We can look at,
Here's your serratus.
trapezius. So you've got posterior serratus, you've got,
You can go in on the serratus.
yeah, let's go look at the serratus. It's a very, there you go. Look what it does. I love that little guy. I just do. He's so great, right? He's like, get over there. Just get over there. But I think people need to really take a moment. So this woman, we're going to help her, but we're going to help her get her rib cage and her hips back over her feet because they're kind of not doing that. This little guy here is putting the serratus on, and they look like bananas, kind of, sort of. Some people try to remember muscles by shapes and sizes. They are going to hook immediately into our external obliques, and they do that. So a lot of times when people are doing Pilates or they're doing things where they feel like, I'm going to pump you up, that's that shoulder blade going around, contraction into the obliques, and you've got your, your universal man. To be able to control that, the opposing muscle group is the trapezius, and they're a team. So that creates upward rotation of scapula. So all those things we do where we ask our clients to do things like this, you have to keep this alive in your body. Our friend there, she's not really doing that. She's probably letting her arms move, and she's moving her rib cage to make her arm move.
Right.
And we do that a lot as we get older. We also, we just change it all up.
Right.
So yep, she will be fabulous to work with because once you take out the rotation, she'll be great.
Yeah, she said she's been bouncing around from doctor to doctor, chiropractors, and just no relief. So
I think it's going to be great because rotation is tricky. Rotation is tricky. You can see it. Once you see it, you can't unsee it. She's going to be one of those gals that takes her arm, and like my grandmother used to kind of do it. She would stick one out longer and the other one would go across her midriff, and the lady's kind of, it's a modelly pose. She probably does that a lot to unwind her natural twist. It's interesting, but I think that she would have great success with us because the left leg is just overloaded but not functional.
All right. Moral of the story, it can be corrected.
It can be corrected. It can be corrected.
Okay.
It is. She's going to be a gal that you work on her rib cage and her hips are going to feel better. Like it's going to be